On today's program, Satcher Health Leadership Institute discusses Community Voices, Healthcare for the Underserved, a division of the Satcher Health Leadership Institute at Morehouse School of Medicine. Community Voices works to ensure a healthier America. The core focus is to build stronger communities by strengthening the health of families. On this edition of Satcher Health Leadership Institute, Community Voices Director Starla Hairston Blanks leads a discussion about the goals and direction of this program.
Welcome to the Satcher Health Leadership Institute Presents. My name is Starla Hairston Blanks, and I'm the Director of Community Voices, Healthcare for the Underserved, one of the 5 divisions of the Satcher Health Leadership Institute at Morehouse School of Medicine. At Community Voices, since our establishment in 1998, we've been dedicated to providing a voice for those who often go unheard. It is our mission to work with those communities and engage them in having solutions to address health disparities. At Community Voices, we focus on 5 key areas: adult obesity, childhood obesity, mental health and wellness, social and health policy, and our focus today will be on our 5th focus area, working with correctional and justice-involved populations. We have a wonderful panel today who will be helping us discuss some of the issues we face here in Georgia when it comes to working with what we like to call justice-involved populations. At Community Voices, we've used our years of research and programming and community engagement to develop what we call the Prison Expressway. The Prison Expressway is 6 key areas that we believe by addressing through policy and action, we can reduce incarceration in Georgia and the nation. Those 6 key areas are education, criminal justice reform, media, economic security, community and family, and health. And to help us look at these 6 areas today, we have our wonderful panelists. First, I'd like for you to introduce yourself, Dr. Pierluigi Mancini.
Thank you, Starla. Pierluigi Mancini, I'm the CEO of SETPA. SETPA is Georgia's only Latino behavioral health agency, providing affordable and linguistically appropriate mental health and substance abuse services to children, adults, and adolescents in English, Spanish, and Portuguese.
Thank you, Dr. Mancini. Dr. Henri Treadwell.
Hi, I'm Henri Treadwell. I'm a professor in the Department of Community Health and Preventive Medicine at the Morehouse School of Medicine and the founding director of Community Voices.
Thank you, Dr. Treadwell. Dr. Carlos Mahaffey.
Hi, I'm Carlos Mahaffey. I'm the Director of Prison Health and Reentry Support for Community Voices, and I work with the corrections and justice-involved populations as well as men's health.
Thank you, Dr. Mahaffey. Let's first tackle the issue of criminal justice reform. Dr. Treadwell, as a leader in this area, I know there is a plethora of issues that could be addressed through policy, but if you had to prioritize, what would you say the top policy changes needed in order to address the issue of mass incarceration?
We absolutely have to address mandatory minimum sentencing. We are sentencing people far beyond the extent of their crime, and we are not making a way for them to come home with jobs. So I could mention also ban the box. I could mention child support, which keeps the fathers away and in fact keeps many of them incarcerated, and many others. But those would be my top 3 at this moment.
Dr. Mahaffey, understanding that you work a lot with youth, what would you say for youth is the top policy change needed?
The top policy change needed for youth is diversion programs. Before youth are seeing the court and admitted to prison or jail, they need to have other options, alternatives to incarceration. So with the school resource officers as well as the police officers, they need to know of those diversion programs that exist so that our youth don't have to go to prison and start on a path of a trajectory to mass incarceration.
Excellent point. Dr. Mancini, I know at SEPTA you see a lot of different barriers with the population that you serve with the mental health and wellness issues. One of the things we want to address is the issue of economic security, not just employment, but how people can live well and thrive in their communities. What do you see as a top barrier at SEPTA with the population that you serve related to employment?
Well, Latinos are the youngest and the fastest growing part of our labor force, especially our future labor force. So everything that we can do today to make sure that Latino youth are able to finish an education and to become employed is going to benefit us all. But we do have the issues in our community where we have a concentration of Latino families in professions and jobs that are low wages. We have also a portion of our population that, because of mixed immigration status, work in jobs where they get paid cash and they're often getting ripped off. And our youth, the way that affects our youth is the inability for them to get after-school work because of language or misunderstanding from employers really become barriers for them to be successful and continue an education. The other part is that we have a high number of Latino youth who are not finishing their education. And many of those is because of laws and policies and rules here in the state that prevent them from attending college. So they see no future. So they drop out of school and end up not finishing their education.
To all three of you, but I'll start with you, Dr. Mahaffey. Understanding some of the barriers for employment that are out there, especially for youth who've had some sort of justice involvement, are there programs and resources available currently for youth who find themselves in that situation?
Thank you for that question. Community Voices actually has a new initiative called Preparing Adolescents to Be Tomorrow's Heroes, or the PATH program. And through the PATH program, we work with justice-involved youth between ages of 14 and 24 to deliver job readiness and life skills training, and also mentoring and support so that they can then be supported in reaching their goals and ensuring that they are employable and successful in their future.
Excellent. Dr. Mancini, I know you offer a host of services at SHLI. What programs or resources do you have available for the community?
Our best program for adolescents is our Adolescent Recovery Support Clubhouse. This is an after-school program where we help youth who are having academic challenges, youth who are having a relationship with juvenile justice, or youth who are having any kind of life issues, family problems, and communication problems. So they come to us to receive counseling. It could be for substance use disorder, for mental health problems, but within that context, we're able to take a picture at all of the areas that are affecting that child. So we pick them up at school, they receive their counseling, and then they come to our clubhouse program where they get to meet with other youth who are in the same situation. We teach them life skills. We teach them, we have a tutor, so they are able to complete their homework and be able to graduate high school on time. And we have many social activities that are free from alcohol and drugs.
Dr. Trywell, I know you have a very big statewide and national focus on this issue. What programmings do we need to have in local communities in order to have community engagement when it comes to the issue of incarceration and reduce these recidivism rates?
We absolutely must have jobs. The business community has to become a partner. One of the things that we often hear from businesses is that we'll hire on a case-by-case basis. Well, that really doesn't help because individuals who are coming home have little money to go find a position.
I noticed earlier you mentioned the term ban the box. For those who may be watching at home, could you explain briefly what ban the box means and what this initiative entails?
Applications in the state have on them a box that an individual who's looking for a job must check to say that they have been involved with the criminal justice system. Quite often that means that that application is put aside and never even screened for the employability of the individual. So we need to get rid of that box, and we need to have individuals considered on their merit.
I'd like to thank you for your insights on economic security. I guess I would like to wrap up this section just really asking a question of all of you of what can we as a community do to help those young people who may be looking for employment, who've had some kind of interaction with the criminal justice system as a community, as an individual?
I think one of the things that's been successful for us is teaching the youth how to take care of themselves. So we do have actual resume writing classes and how to dress for success, how to dress up for a job interview. And we're starting to meet with businesses, and if they receive a referral from us, then they're able to say, okay, this child has been able to go through a process where they learn how to do these things, and then maybe they're more employable than others.
Wonderful. It's wonderful learning about some of the community programming available. And right after this, we'll be talking more about health, education, and community engagement.
More when we continue on Satcher Health Leadership Institute Presents. The mission of the Satcher Health Leadership Institute is to develop a diverse group of exceptional health leaders, advance and support comprehensive health system strategies, and actively promote policies and practices that will reduce and ultimately eliminate disparities in health. The Satcher Health Leadership Institute has 5 divisions that advance behavioral health, sexual health, health promotion and disease prevention, access to healthcare, and health policy initiatives. We develop leaders who can transform their families, communities, schools, work, and healthcare centers to improve health and well-being. We work with individuals, parents, students, schools, places of worship, doctors, communities, media, governments, and organizations to promote transformative leadership, good health, disease prevention, policies and practices that will ultimately eliminate disparities in health. Through partnerships and collaborations, we develop innovative solutions that are meaningful and help to reduce disparities that negatively impact health, well-being, and life expectancy. We seek and appreciate partnerships and treat our partners with respect and civility that results in useful, innovative programs. Our programs include, but are not limited to, leadership programs, postgraduate policy leadership fellowship programs, smart and secure children parent leadership programs, community health leadership programs, community programs, sexual health initiatives, re-entry and reduction of incarceration of Black male initiatives, integration of behavioral health and primary care, quality parenting program, childhood obesity, and community health initiative solutions to address health disparities and promote health equity across lifespans. Visit our website at shli.msm.edu to see how you can partner with us to transform healthy communities.
Welcome back to Satcher Health Leadership Institute Presents, where Community Voices Healthcare for the Underserved today, and we're talking about justice-involved populations and barriers and opportunities for improving our communities. So our panelists, we were just talking about some of the economic security barriers and some of the criminal justice barriers. But as the Satcher Health Leadership Institute is based inside of Morehouse School of Medicine, a medical institution, a lot of times we get the question of, is incarceration a public health issue? So I would love to ask you, what do you think the role is of the public health community in addressing incarceration?
Well, I think that we have a concern as a medical school about being able to ensure that everyone has a primary health care home. And the difficulty is that it is impossible to serve populations who do not have health coverage. And with the lack of expansion of Medicaid in Georgia and elsewhere, we have great difficulty getting people in and providing services to them. There just are no services out there. The linkage between this and recidivism and economic development, too, is that individuals who have health insurance are less likely to return to prison and more likely to be able to hold standard employment. So we need to really bring all of these things together and under the umbrella of the social determinants of health, and employment being one, payment for health insurance being another. There is no such thing as free health insurance. You do get a bill, and after that, a collection notice.
Dr. Mahaffey, what do you see as the role of public health in addressing incarceration?
There are many avenues in which public health in addressing the issues of mass incarceration come into play. As Dr. Treadwell said, a lot of these things are linked to one another. Employment and lack thereof employment is really based on the health care of that individual. And it really comes to priorities that they actually have to make at that point once they're released. And, well, what are their options? And if they have no employment, they don't have any money, they have to take care of themselves. And they're more likely to focus on getting a job, even if they are in poor health. But in the same standard, that health will limit them in the abilities that they're able to do on their job. So they go hand in hand with one another, and that's why it is a public health issue.
Dr. Mancini, on the issue of health, knowing that you work a lot with substance abuse and with the community's impact really that comes from substance abuse, can you talk a little bit about the linkages you see between incarceration and substance abuse and other mental health conditions?
Thank you. It's an important question because we have to remember substance abuse and behavioral health actually are public health issues. Now, there is a troublesome relationship between alcohol, drug use, and crime. And we have estimates that up to 80% of all of the crimes that were committed that require incarceration involve some type of alcohol or drug use. And so about 70% of prisoners are estimated to have had or been high during the commission of a crime, and there is no treatment available. So what we're doing is we're locking people up who have an illness, because some of those do have an illness, and we're not treating the illness. So they're being sentenced to prison, they're coming out untreated. And to make it worse, they're coming out into a community that often is not prepared to serve that illness. So we have many people today who are waiting for slots, for chairs, for beds to receive substance abuse treatment. And this affects most of the major crimes, from family violence to serious crimes to public disorder to driving under the influence. And it's something that we are behaviors that, because of the pharmacology of substance use and illicit drugs and alcohol, it makes people behave in a way that they otherwise wouldn't behave under the influence.
You make an excellent point about the availability of resources. Dr. Treadwell, knowing your work with some of the statewide agencies, do we have enough resources to really treat the issues that we see for those who are returning home around their health needs?
We have enough resources. We can simply cease and desist sending so many people far away where it costs us $30,000 to $50,000 a year and give them community-based treatment. It really is political will to turn around and reshape our systems so that all of us benefit. The other thing that we have is the policy of not providing people who are recovering from substance use disorder with food stamps or TANF benefits. We know that having access to food is very important as a part of the recovery process. But our policy currently is no food stamps. So we're really just creating that problem all over again. So we have the resources to solve the issues that are facing us, but we have to simply have the political will to do so and to be risk takers as leaders in government.
Thank you. I'd like to shift gears for a moment and talk about education. I noticed that a lot of you have mentioned the term education, whether you're talking about employment, where you're talking about recovery, just looking at that future life trajectory. So I would like to know, what role do we see as the education system and educators having in addressing the issue of incarceration? Dr. Treadwell?
We have children, so many children in our state and nation, over 2 million children who have parents who are incarcerated. These children sit in classrooms bored, scared, bullied, depressed, and we characterize them, I think, as being non-responsive. But we really need to take another look at them and see whether or not there are things that we can do to help them feel secure, cared about, and loved. It doesn't mean that the parent who is away does not love them, but they need some help day by day. The other thing that we need to look at, and was mentioned earlier, is policing in schools. We know that more young people are pushed out of schools when policing is done that does not take into account the other variables around that child. Studies have shown arrest rates are up when police are in school. Not to say we shouldn't have police in school, but they need to have a different toolbox and a different way of responding to today's children.
Dr. Mahaffey, I noticed that you and Dr. Mancini have all kind of talked on the issue of family support and that kind of social support. So what role do you see as the community and family playing when it comes to providing social support for young people and even adults who are returning home from prison?
As Dr. Treadwell mentioned, a lot of children do have parents in prison, and it's that instance, an opportunity for the community to step in as that support system. The benefits and the success of the child really depends on their support and having a stable family structure. And when the father or the mother is absent from their home, that leaves gaps and things that one or the other will not be able to provide. So then it's the opportunity for mentorship, for communities to support that youth and child by having programming and pushing them and promoting them in their endeavors and successes to achieve in life, and really providing that stable family structure that they may not have due to an incarcerated parent.
Dr. Mancini, would you like to address also the role of, I guess, family unification around recovery?
One of the issues that we face is we have Latino families with different levels of acculturation. We have Latino families that have been here for many years, many generations. And then we have those that just got here yesterday. So when it comes to trying to be part of a community, sometimes we're facing challenges of Latino families understanding how that works here in the United States. Even with laws as simple as knowing that the legal drinking age in the United States is 21, where in Latin America there is no formal legal drinking age, creates problems, because if the parents don't understand the laws and the policies, how can they support the children so the children don't get in trouble and don't have a relationship with juvenile justice for issues that is basically that they don't understand. But what we have found is that when we properly, culturally, and linguistically reach out to these families become the strongest allies a community can see. And you can see the communities totally restructure how they do things once those families understand how the process works here.
Wonderful. I know we've been talking a lot about youth, but I would be remiss if I didn't ask questions about some of the adults that we see that have returned home from prison, whether it's from a shortest stay as 2 years or 5 to 10 years. So how do we as a community help support those adults who are finding themselves returning home to a different community and social structure than they may have seen when they once left? How can we help them reintegrate into society and prevent recidivism or returning themselves to prison?
You know, one of the things that we haven't talked about yet is oral health care. And I met yesterday with an individual who runs a large homeless center in Miami. And he said his largest problem is getting oral health care for those coming home so that they can get jobs. And so I think that's just one very specific example of what we can do. But realizing 70% of the children who go to juvenile justice also go to prison ultimately. So we really are helping them all when we make sure there's jobs and family economic security and housing and all of the things that we've mentioned. We have to do it all, step outside of our role and do things that we didn't think we needed to do, but that need to be done.
One of the challenges that we're facing is on hiring practices. So sometimes we do try and reach out and help the adult that came out of prison, and then we're faced with a background check that makes them ineligible to work in this particular field for something that makes no sense. So a lot of those eligibility issues need to be addressed at the state level, so people who are coming back and who do have a second chance and who have either understood their mistake and made changes in their lives, for us to be able to support them to continue that. What we're doing right now is that many times we're setting them up by continuing to shut those doors when they are trying to get better. So I think as a community we can do better, as a state we can do better.
Absolutely.
In the state of Georgia, when someone is released, they receive $25, a bus pass, a change of clothes, and if they're on medications, either a 15-day supply or more serious medications, maybe a 30 to 45-day supply. And that's it. There really needs to be programs that really start before that person is released, in which they can make an easy transition out into something and somewhere for them to go, to be able to hone those skills that they weren't able to get when they were incarcerated, to ensure that their success, especially if there's no family that supports them. There needs to be a community that supports them. And we have to ensure that there are programs, communities, and partnerships that are ready to accept these men and women coming home, because they are coming home.
I noticed we mentioned a lot about coming home, and I think one of the things I would want us to address before our time ends today is the impressions of media. Dr. Treadwell, in your book, Stereotypes of Black and White, you talk a lot about the media's impact on shaping the opinion and the thoughts of those returning citizens, especially those from the African American and Latino community. What role do you see as media playing?
Media really has to do a much better job of meeting people when they leave incarceration, leave facilities, and follow them home and follow them around, and then tell the community where the barriers are. Media also must get itself in check around stereotypes and perpetuation of stereotypes. Most people don't interact closely with other communities that are not like them. And so media has the responsibility to begin to make relationships possible between communities who may never meet, but they really have to survive together. So we really have to have more in our newspapers, television, and radio, and it does not need to be by people who just look like us, but it really is a job for everyone.
I agree. I think the media can do a better job of celebrating the successes, because often what you see is the person that got arrested and there's race and ethnicity, and sometimes the only pictures published are those of people of color. But we miss the opportunities, because the opportunities, for example, September, we're celebrating Hispanic Heritage Month. But September, we're also celebrating Recovery Month from substance abuse and other disorders. So we need to take this opportunity to celebrate that treatment works for people that can access treatment. Treatment works, and that there are successful Latinos and they're being celebrated during this month. And I think we can do a lot better showing people that given a chance, anyone that's coming back from prison can recover, they can be successful.
I would like to thank all of you, Dr. Pierre Luigi Mancini of SEPA, Dr. Henri Treadwell of Morehouse School of Medicine, and Dr. Carlos Mahaffey of Community Voices. I would like to thank you also for tuning in and joining us. While this conversation was brief and is ending for today, I invite you to visit our websites and learn more about the work that we're doing and continuing to do with justice-involved populations. My name is Starla Hairston Blanks, Director of Community Voices, Healthcare for the Underserved at the Satcher Health Leadership from Morehouse School of Medicine, and I thank you for tuning in today.
Dr. David Satcher is director of the Satcher Health Leadership Institute. Dr. David Satcher is the 16th Surgeon General of the United States. Funding for this program was provided by a grant from the Southwest Hospital and Medical Complex Foundation.